Greetings and welcome. This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. On this episode, we're going to hear the inspiring story of a woman who was diagnosed with blood cancer, but found her way to survivorship thanks in part to her faith and her realization that knowledge is power. She is Francie Norden of Spokane, Washington, and hers is a story that should resonate with anybody on a cancer journey. So here she is. And Francie, welcome to Cancer Interviews.
Thank you for inviting me. I'm excited to be here and share my story.
And let's start your story from the same place we always like to start, and that is to learn a little bit more about you and your life exclusive of cancer. So if you would tell us a bit about where you're from, what you do for work, and when time allows for fun, what you do for fun.
Well, I'm from Spokane, Washington, which is in the Pacific Northwest. I love dancing. I love hiking, trail running. I love boxing. I love spending time with my family. I love spending time with my grandbaby. And, I am a motivational speaker, and I do consulting for hematology oncology clinics, providers, and drug pharmacy companies.
That sounds like not only an active lifestyle, but a healthy one. So against that backdrop, I suspect that when something was physically amiss, that you noticed it right away. When did you notice something wrong, and how did it manifest itself?
Well, actually, I noticed it in January 2020 when my left foot started swelling, and no matter how much Lasix my doctor gave me, it wouldn't go away. Later on, I was driving and had an episode where my left eye went right, my right eye went left, and I went completely blind. And they thought I had a seizure. They thought I had a stroke in the ER, but it came back fine. And so they referred me to back to my primary care. Didn't do much about it. I just kept going along my way. I'm very busy. I have a health and fitness company as well. And so between everything I was doing, I just didn't really spend a lot of time looking at the little signs along the way. I ended up in September of 2020 having some epileptic episodes. I didn't know what it was. By December 9th, 2020, I was diagnosed with epilepsy. In my heart, I felt to go the natural way, do natural medicines, but the conversation with the provider was that it was very imperative that I start with medication because it was explosive, unknown etiology epilepsy. It's important that you understand this because you'll understand my decisions for treatment later on. So throughout my process of trying to find an epilepsy drug that worked for me, I had several reactions and kept having to change medications, and finally came to this one medication, was on it for 6 months, and then one day I was found on the floor of my living room. My face was bashed in and I was seizing, and they took me into the ER, admitted me to the hospital because I had very low potassium. They actually said if I wasn't found, I would have been dead by the morning. And then throughout that hospital stay, 12-day hospital stay, was found to have Pancytopenia, which is low red counts, low white counts, and low platelets. I advocated for an inpatient hematology doctor to come and see me instead of an outside referral. Just due to the timing and feeling safe, and he was very thankful I did. And he started a major workup. Well, one of the things that they were considering was Myelodysplastic syndrome, but what he wanted to do is he said, epilepsy medication are natural immunosuppressive drugs. All of them are. And they all deal differently in that category, but in people's bodies. And it looks like yours is going a very rough route. So we need to change. We'll take you off this medication and start you on a different one that has less immunosuppressive side effects. As I started tapering off, my counts started going up. But by the 1st of July of 2021, July of 2021, my epilepsy was out of control, started me on the new drug, and then my counts went down. And this was 6 months or 5 months of counts up and down, counts up and down. Well, oncologist here said, you know, you need an academic center. We can't figure out exactly what's going on. I ended up with a heart murmur by this time, and my legs were, and my arms and my abdomen and even my chest had bruises all over it. And my counts were nothing stable. And so went to an academic center. He did some more tests, and he said, well, you have to weigh the risks of the epilepsy medication and, you know, your counts. They're not drastic right now. So let's just kind of wait and see. And so that was October. By December, he was calling me saying, I need you to get off this epilepsy medication right now, because my counts had dropped. So, and he says, and I'm referring you back to the Mayo. At one point in 2021 early, I had a Mayo EMU stay, which is an epileptic monitoring unit. And I saw an infectious disease specialist and a whole bunch of other specialists there that did a bunch of workups. So he was thinking, well, maybe it's not just epilepsy medication. Maybe it's a virus that you have had in your body since you were in kindergarten. And so, so here we go back down to the Mayo Clinic in January, saw the infectious disease specialist, and I had kept journal, I had kept pictures and videos. And that is one of the key things I tell people that's in the diagnostic phase of not feeling right is journal, pictures, and video. Because they speak volumes to your doctors. And she saw all my pictures, my journal, my videos, and she sent me to multiple specialists. She didn't know exactly what was going on, but and then throughout all of those specialty referrals, there's other things that was popped up, but I saw the hematologist oncologist, and it was determined we need to do a bone marrow biopsy on her. And his concern was for, it's a rare form of AML, and it's called acute panmyelosis with myelofibrosis not having achieved remission. And so they did the bone marrow biopsy. We waited for, you know, the results. I went home, all this kind of stuff. And sure enough, it came back with that diagnosis. And so, you know, was epilepsy the cause? No, but the medication is what they're all considering is this main culprit. And I have this very rare side effect. And there are studies out there that show in the first year of an epilepsy diagnosis, blood cancers are very high for an initial diagnosis. AML was the highest in that category, and it was 3.48%. So, you know, what do? We got to, you know, options are on the table, but because of options in the past that were on the table for me that my gut said don't do, and I did it anyways, and look, a year later, my body is struggling and not doing well. I really hesitated on a lot of medications and options, and I was definitely not going to do a bone marrow transplant just because I had seen what people had gone through with graft versus host, being in the hematology oncology industry since 2009. So and the other issue was my counts were so low that they couldn't get me well enough to even take the treatment. I ended up getting an infection, very rare in adults, called parvo, because of my absolute neutrophil count being so low. And so then we had to treat that, and we had to treat this, and we had to treat that before we can even deal with other things. But, you know, I believe in natural medicine. I believe in power of prayer. I had tons and tons of people praying for me. I spoke to my body every single day that my bone marrow is going to produce 100% perfect cells every single day. And diet, huge diet change, rest, and of course off the epilepsy medication. So things started to change.
By the way, if you like what you hear in this segment, we invite you to subscribe to our podcast by clicking the links below. Once there, you'll see a bell icon, and if you click on that, we will notify you when we post a new interview. Now, Francie, when you're going through all this, if you would just describe physically how you felt, it sounds like mentally you were quite sharp in deciding how you would address this, but physically, how were things?
I was terrible. You know, again, low blood counts, irons, my ferritin at an 8, and, you know, my iron's low, and my neutrophil count is 0.47, and my bone marrow, my white blood counts are below 1, and, you know, just, and red, you know, your HCT or hematocrit and hemoglobin just low, and then ups and downs and everything. It's like, physically, there were days I don't even know how I got out of bed. And there are days I didn't get out of bed. But I have a real strong faith. I really have a strong faith. And I don't believe, you know, if you continuously think negative, you're going to produce negative. And I would rather take the chance of thinking positive. Every single morning, I listen to a hope message of some sort, 10, 15 minutes, and sometimes it depends on the day, 2 hours. I don't let my body, my mind, and my spirit go without filling my heart and my spirit with hope.
You had mentioned a change in diet, and I want to get to that in a second. And we should mention that on Cancer Interviews, we do not give medical advice, but I would like to hear, in terms of your natural ways of addressing your blood cancer, in which direction did you lean?
Well, first off, I have had a registered dietitian nutrition named Heather Gabbert since 2015, and actually before that, but really seriously since 2015. So I've been mainly on a paleo diet. I'd lost naturally from 2015 to 2020. 150 pounds. And so I did a diet, exercise, nutrition, and counseling. And so everything was all natural. There was nothing, no surgeries, no diet pills, no nothing. So I really, again, reached out to her and I said, listen, you know, this is what's going on. What do we need to do? And she's like, Francie, we really need to work on a more anti-inflammatory diet. And so she really has helped me. There are days that I mess up or, you know, struggle. But she's been patient with me and really helped me. I also saw a naturopath down in Arizona, and she started me on, she did a full evaluation and she started me on certain products, and I faithfully take those. And when I go back down, I'll be seeing her again. So, you know, it's just, again, stopping the epilepsy medication was a key factor, we truly believe.
You'd mentioned diet. What are some of the things that you ate when you were addressing blood cancer, and do you stick with that diet now?
Well, I'm still adjusting, but paleo is mainly a meat, a lot of protein, okay? So I'm O negative blood, and so they typically are best with protein, a paleo diet. So I had a lot of red meats, and so I have slowly moved over. Like every morning I had bacon, okay? I've moved over to, I do sliced mushrooms and sliced and diced onions, saute, have my organic, I'm doing all organic, nothing with antibiotics in it. I mean, it's like, I'm really strict. I'm even working on my water, the type of water, just everything that you can imagine, and taking toxins out, even working on my house with toxins. And so, you know, I just, even the integrative medicine doctor there, he said, you know, he's doing a toxin review on me and stuff. And so, I mean, the biggest thing is I'm staying with it, because I never, ever, ever, ever want to go back again. That was the hardest part of my life. And I'm still recovering. Just because your, you know, bone marrow biopsy comes back and says the inside of your nucleus of the cell looks great, and there's no cancer there, doesn't mean that everything's perfect, everything's normal. I'm off of epilepsy medications. I had 4 grand mal seizures, and you know, and I have to go back, and they're studying my brain and my bone marrow, because I've never seen anything like this before, you know, and my counts dropped the last 2 weeks. So, you know, it's going to take time. And I want people to understand, especially the family members, it's going to take time to recover. And as I told my friend, because she sent me a message, we were cancer patients. We met on Southwest Airlines, and she texted me there. She's like, I wish people would understand I'm not going to be the same ever again, you know? And I said, you have to be careful who you talk to. And then when you skim down your circle of influences to know who you can trust, then remember the intent of the heart when they're talking to you. Just remember, they want to find the miracle for you. But we have to let them know, even in recovery, it's going to take time.
Let's talk about your sources of support. You've mentioned this a little bit so far, and I want to get back to it. You've mentioned your faith, and if you would elaborate a bit on how that has come to your aid.
Well, when I was first diagnosed with epilepsy, I met with several spiritual leaders and counselors, because my health and fitness is a Christian-based program, and so I know a lot of spiritual leaders. And I met with a lot of them, but one her name was Pastor Teresa McCain at one church, and she and I have this real bond. She's been with me through my whole weight loss journey, everything. And she said, Francie, when I was praying for you, she says, I was reminded of the story of the 10 lepers. And, Jesus was walking along the way, and the 10 lepers came up and wanted to be healed, and they got, Jesus said, go, you're healed. And they all turned and went away, and they were healed. And then one turned around and came back and said, I want to thank you for this. And he says, where's the 10 others? And he says, they're still going. I'm paraphrasing, and Jesus said, because you recognized and you give thanks, he says, you will be made whole. And, and when he talked to the leper, he said, and they were healed while on their way. So first off, I knew I needed to continue my work. I needed to continue advocating for patient advocates. I knew I needed to continue advocating for health and fitness. So my faith gave me direction during my treatments and my diagnosis and my health journey, okay? But it also helped me go to sleep at night, and it helped me wake up in the morning. So my resources were, I had a ton of spiritual advisors and counselors, and I could just reach out and say, I need prayer today. Today's a rough day. And they instantly prayed, no questions asked. And then my family, my 2 boys, when epilepsy started, they were the ones that picked me up off the floor after I had my first grand mal seizure. I had lost my bowel movements. They picked me up, carried me to my bathroom, and they took care of me, These are young boys, at the time they were like 26 and 20, and they're having to pick up their mama off the floor who's dirty. And then hearing the diagnosis and hearing another treatment. This has been a long journey for me, but they always keep saying, Mama, you're the strong one. Don't give up. And so, and then having my new grandbaby, Nova. I love her. She's such a joy. But then I have a significant other who every day, he's saying, good morning, gorgeous. And it reminds me, even though my body's got bruises everywhere, he finds me gorgeous, and I'm gorgeous from the inside out. Does that make sense? And then, there is my friends, the ones that trimmed down. I had to trim down into my inner circle. They don't hesitate to get in with their hands dirty and get things done for me. They don't hesitate to pray. They don't hesitate to, let me vent. And they don't hesitate to say, hey, France, I think you're kind of wrong in this area, but we still love you. It's all, and that's why I said, it's the intent of the heart. Once you skim down your friends and you know who's really true and who's safe to talk to, you've got to remember the intent of the heart. And I learned that in my brokenness, humbleness was met at the same time. But it says that God is close to a contrite spirit. That's a broken spirit. And I knew he was with me even when everybody else was gone or couldn't be there. I knew God was with me, and he heard my prayers. And, now we have great results. We still have a long road to go, but I'm not afraid. And that's the other thing I had to do, is I had to face my fear. What is the worst thing that could happen? I could pass, Well, guess what? My kids are great. I've made an imprint in this world with hematology, oncology, health and fitness, started the Boys and Girls Club of Kootenai County, done lots of good things in this world, raised my amazing family, you know, and then my heart's right. So it's a win-win either way. Heaven's a good place. And I know my family will meet me there. So I had to just let go of the fear of the worst case scenario. Is it worst case? I mean, that's for you to decide. But, you know, no matter what, I cling to the Bible, his word, and listen to hope messages all the time, every single day. And days that are hard, I'll listen to them either all day long or at least a couple hours in the morning.
Our guest is Francie Norden of Spokane, Washington, and she's telling us about her journey not only with blood cancer, but the epilepsy that preceded it. Francie, question, at what point did you sense that survivorship was around the corner, that survivorship was possible?
Literally, it wasn't until I got the results, perfectly honest, because like they did an emergency bone marrow biopsy because my counts dropped so low, and then all of a sudden things are coming back good. But, you know, I always hope, I always believe. That's what I said. It was like, you know, I'm always believing and hoping, but it says faith is the evidence of things not seen. So I hadn't seen it yet. So now that we obtained this one part, it was like, oh my gosh, you know, okay, now I believe for total recovery. And that to be made whole means as if it never had happened to my body. So I believe now that I will be returned as if it had never happened to my body, but I will never be the same. I only will be better. I have compassion. Now, when I advocate for my oncology patients, I've been on the other side now. I can advocate even more. And so, you know, it's just survivorship. It's kind of weird saying it now, but I want to say overcomership. We overcome a big mountain, lots of little mountains on the way there.
Francie, we're gonna wrap things up now, and just like we start from the same place, we like to end from the same place. And I know in advance that the answer to this question is going to be something that's right in your wheelhouse. If you were to encounter somebody who had just been diagnosed with blood cancer and they're facing this mammoth task, this journey ahead of them, if you had a message for them, and out of this message, there's probably a lot of things you would want to share with them. But if there's one thing that stands out above all others in terms of a message to somebody who's just been diagnosed, what would that message be?
There's two scriptures I have to say. Then I always tell them, I talk about it all the time. The first one, the hope deferred makes the heart grow sick. Okay. The second one, I stood on this every day. Psalms 27:13. I would have lost heart unless I believed I would see the goodness of the Lord in the land of the living. And I would tell them, don't give up. Professionally, I would tell them, get a second and a third opinion. Makes a big difference.
Okay, and that is tremendous advice that packs a great wallop. Francie, thanks so much for your story. Really appreciate hearing it. And of greater importance, our listeners and viewers are going to appreciate it, because that's advice that is real-time advice that they can apply. So Francie, thanks very much for your time. Thanks for being with us.
You're welcome. Thank you so much.
And that's going to conclude this episode of Cancer Interviews. Want to remind you, as you go on a cancer journey or a loved one does, that you are not alone. There are plenty of people out there just like Francie who are there to help you. What you need to do in that situation is listen. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews podcast.